All right, everyone, we'll go ahead and get started. So again, thank you all for joining us today. For those of you who aren't familiar, my name is Christopher Jam, and I am one of the account managers for Airrosti Rehab Centers here in our Austin region. And today we have with us Dr. Jake D. Arden, who is one of our providers at our new Far West location that we have in Northern Austin. So before we actually get started, just to go over some housekeeping things as always, as you guys saw whenever you were admitted into the presentation, your microphones were muted, so we can cut down on the background noise and make sure that we get you all the information as quickly and as efficiently as possible. And of course, but if you have any questions, for sure, shoot those over to us in the chat function. Also, before we go ahead, make sure that you guys send me your first name, your last name, and your employee EIN number so that we can make sure to get you your wellness credit. You can send that over to me in the chat function as well. Um, and just to go over kind of who we are, what we kind of do, if you guys aren't familiar as well, we're with Airrosti. We're a healthcare provider group that specializes in treating soft tissue injuries. And today we're going to talk to you specifically about shoulder injuries, the different mechanisms, the different signs and symptoms of different things that could be going on within your shoulders. Dr. Diarden is going to go over that information for you. So, and of course, as we go out through the presentation, if you guys have any really specific questions that you would like to ask, or it might not be necessarily something that you want to ask over a virtual platform, you can access what we call our virtual injury and pain chats, which will be in a QR code on every single slide. It's it's no obligation. It's a one-on-one chat call that you can have with one of our doctors about either something about the content in the presentation or about a specific injury that you might be having that we might need to get some answers for you to get those things taken care of for you. So without further ado, I'm going to turn it over to Dr. D. Arden to take you through exactly what we'll be talking about in the presentation.
Well, good afternoon, everybody. Thanks for joining us. So with this presentation, we're going to be going over what are some common shoulder injuries and which ones occur. We'll also kind of discuss which ones tend to be even show up more in the office compared to others, even though all of them are fairly common. And then also we want to give you a couple tools so that you can prevent the injury and help avoid even having to come in the first place. But of course, we're happy to help if you need us. And then also we're just going to talk about how we keep ourselves accountable and making sure that we're seeing the progress we need so that you get the care that you need. So here's just some very generalized terms of different conditions that the shoulder can have. Probably the most common, it's listed in order essentially of how common we see these in the office. So a rotator cuff strain, and we'll get into more detail with each of these. Then we have impingement, tendonitis. Those are kind of neck and neck, bursitis, and then arthritis. And then we'll also be going over the anatomy and making sure that we have a good foundation for what's happening in the shoulder. So the shoulder, we kind of take it for granted because it can do a lot, and we think it's just a simple, up and down motion, but really it's a huge complex of not just the shoulder itself, but we have our shoulder blade, we have our chest, neck, everything's involved, and it's often called the shoulder girdle. And so you really can't address the shoulder without also addressing the mid-back and the neck in connection, just because they play such a vital role with each other. The interesting note, as you can read here, the shoulder has the most directions of movement that it can do. So, and we don't even think about it. We just think A to B, like I'm going to grab this can right here, or I'm going to turn on a light, and we don't think a second of it unless it's in pain. And when it does hurt, we know it because it's such a high traffic joint. We use it all the time for, I mean, you can list the variable activities that it has. So common terms used for the range of motion. So we have adduction. So that's just the shoulder coming into the center. Then you have AB or abduction. That's the shoulder coming out. And then flexion is, oddly enough, is the shoulder coming up like this. And then extension is going backwards. And then you hold this shoulder in another position, and it can do other ones just like this. So it really has, again, a wide variety of range of motion. And that's what makes it so challenging when it does have problems. And so here's just a general overview of the anatomy. And so we talked a little bit earlier about the rotator cuff muscles. And with the rotator cuff muscles, that's the supraspinatus muscle. So it's really little right on top of the shoulder there. There's 4 of them involved in stabilizing the shoulder. And when we talk about it stabilizing the shoulder, we think of it we just leave it at that. We don't think anything else. But what that means is that if they're not doing their job, then the bigger muscles, so for example, your trapezius, your levator scap muscle, those can dislocate the shoulder and pull them out if the rotator cuff muscles weren't there. And so that's where a lot of the conditions arise from, is there's an imbalance between the stronger, bigger muscles and then the smaller, more fine-tuned rotator cuff muscles. So with the rotator cuff, a lot of times what will end up happening is you can grade it in different levels of severity. So the most common is going to be a strain, and so that just means that the muscle has been overworked and it's starting to let you know that it's not happy with some of the activities you may have been involved in. And so one of the things though is that it holds the ball and socket, so the head of the humerus, inside the shoulder, and it allows for the movement. So the supraspinatus allows for that movement to bring your arm up. It starts that first 15 degrees of that motion, and then your deltoids, often referred to as bullies, come over and they take over the rest of the motion. And then your subscapularis muscle, which is on the inside of your shoulder blade, that one allows for your arm to come on the inside. And then the other two, the infraspinatus and the teres minor muscle, those ones allow for your arm to come back this way. So they help with that motion, but I would say their most important role is the stabilization of the shoulder. And so one of the things that there's a telltale sign that one of the rotator cuffs is involved, and that's if somebody's grabbing and cupping their whole shoulder like this. That's basically letting you know that one of the rotator cuff muscles is causing an issue, because that's the body's natural response to try to stabilize the shoulder. And as it lists out here, pain will increase at rest, and also while you're sleeping. And it can be either, you don't have to be sleeping on the shoulder. It can also just be while you're on your other side as well. And then at the bottom one here where it says crackling sensation sound, that one, it's more if there's pain involved with the cracking and sensation, because a lot of times, I'm sure many of you have noticed, you're moving your arm around and then you'll feel that cracking and popping sound, but there's no pain involved. That is more suggestive of the muscle being so tight, it's like a guitar string going over the bone. And so there's several different causes. The acute one, that's more like if you, for example, pull through the ball too hard, had too many repetitive tasks, and then that's going to be like an acute situation over the weekend. But then there's others that can develop over time. So such as sitting at your desk and working at your computer, and then as there's a muscular imbalance, it just starts to pull on the muscle, and with that repetitive stress, the injury starts to develop. And you're going to see this as a common thread throughout all these different conditions: repetitive overuse, weightlifting, especially if with improper form, and then of course different sporting activities. The next condition we're going to talk about is impingement. And so what happens with this is there's these things called bursa, and they're these little fluid-filled sacs that essentially help the muscles move through their pathways, and also allow so there's not a lot of friction buildup. And especially you want to have that in a high traffic joint area, because if it's moving a lot and if there was a lot of friction, then it's going to create heat, and it's going to make things wear down a lot faster. So what ends up happening though is there's some sort of inflammation going on, and then the muscle tries to move through, and then it keeps getting grated on. And so with impingement, one of the most common forms is going to be you're going to feel pain on the front of the shoulder here, and it's going to be any kind of a lifting motion that's going to recreate the pain. You can have it where it's on the back of the shoulder. Not as common, but it's possible. And again, one of the things that plays a big role in impingement is definitely with posture, and then also like if you're essentially your shoulder's not in a position that it needs to be in, and then as you go to move or you're over tightening the muscles, it all takes up space in there. And so if the space is crowded, then we start to develop those symptoms. And so one of the quick ways to tell this out is just as this is showing, we'll have a patient raise their arm up, and if we get pain in between that 60 to 120 degree range, that's a little bit more suggestive of that. And so that's one of the tests we'll do. But then if you get the pain where you're at the very top of the range of motion, then that's letting us know that it's more like the joint for where your collarbone and your shoulder meet. So it's interesting because you get the pain in a similar area, but then how it responds into the movement helps narrow down what's actually going on. And with this, you're going to have a sharper pain. It's definitely going to be anything where you start to bring it overhead, or you go to reach behind you to say put on a jacket or grab a purse or something like that. And then, of course, the theme that we've been talking about, it can be from the way that your shoulders, if they're held forward. It can also just be from weightlifting sports, repetitive tasks. So again, these are things that we have to watch out for with our shoulders. Bursitis, so this one, while it is included in the common injuries, I would say this is probably one of the more least common of the ones that I end up diagnosing in office. However, with that being said, just because we have these individual situations going on doesn't mean you can't have a couple of them going on at once. And so a lot of times, with the bursitis, you can also have the impingement going on as well. And so they combine together. And so usually I tend more towards calling it an impingement when, it might also be a bursitis. The treatment and then the protocols for getting results end up being pretty much the same. But what happens is with that bursa, that little closed fluid-filled sac essentially gets inflamed, and it lets you know it's inflamed by not doing its job where allowing the motion to happen more smoothly. And so with that, it's a little factoid here for you, is that there's 6 in the shoulder, but it's not just the shoulder that has them. They're around a lot of the several other joints, like in our hip as well. And so yeah, when you do have true bursitis, it's definitely one of those things where it's kind of like a warm, achy, and also and it can be an intense pain as well. So one of the things too, continuing on with bursitis, is that with increased motion, you're having it do its function more. And so a really simple way to look at just overall conditions as well, not just exclusive to bursitis, is that as function improves, then symptoms and pain should go down. And so like with this one, if it's doing its job and as you start to warm up and move around, then you should see the pain go down. The problem is that if it is true bursitis, then you might get that temporary relief, but then it's going to come right back up as the swelling increases. And causes are just the same as any other shoulder condition, is where we have that overload of stress. And essentially that's how you have to look at it, is it's being stressed in a way that the body doesn't handle well with. And we get a lot of that with the way we work, working at computers. And then also we'll continuing those poor posture with the way we eat, the way we drive. I don't know if you've noticed, when you get caught in traffic out there, like on Mopac or 35, your head starts coming forward, and without even thinking about it, you're already like in a hunched position, kind of like this picture here. So tendonitis, so this is something that can happen throughout the whole body. So a tendon is the attachment point for a muscle on the bones. And so it's one of those things where that's where the muscle is able to, as it contracts, it pulls on the tendon, then it pulls on the bone, and we get the movement that we have. And so with this, if you get basically inflammation that's going on at the tendon point because of repetitive overstress, then that's where it starts to get inflamed and cause pain. This is actually probably the most common, and then in connection with like a rotator cuff strain. And it's one of those things where, at first it doesn't seem to bother us, and then we continue to do a certain movement and we keep going and going, and then eventually it just starts doing these little, this sounds aggressive, but like these micro tears. And essentially as that does that, then we start to feel the pain and why that's happening there. And so with that, it's making sure to, again, with all of these, stabilize the shoulder so that it's not having undue stress put on it. And so with this one, often it's not going to be as sharp compared to some of the other conditions. This one's going to have that achy feeling, and then when you go to use that specific muscle, then it can increase the pain there. And the other thing with that is it doesn't have to be just a singular muscle. A lot of times it's the whole shoulder complex involved. And so then you have, for example, your chest screaming at you, and then also you have something on the top of the shoulder and the back of your shoulder, all doing their job to make it hard to get the rest or relief that you need. Arthritis, so this one, we'll start with causes. So of course we use our shoulders a lot, but also it's a natural part of the aging process. And so as the joint capsule itself gets inflamed, then we start to feel the pain and with certain movements. And then of course there's a family history with it. It can also play a role. And so with this one, the key is not so much addressing, because we can't make structural changes as far as like if there's any like bony overgrowth that's affecting the joint to become inflamed. But again, with the shoulder, the most common, the broken record that you have already probably come accustomed to is stabilizing the shoulder so that it stops having such stress put on it so that it can have that pain relief. This one tends to take a little bit more as far as treating and getting the results we need. And it really requires consistency with the exercises and stretches to really get an effect there. If that ends up happening and you hold your shoulder in a position where it's not moving and you're not using it a lot, it ends up making it worse. And so that's why we want to make sure to keep the shoulder moving, but also keep the whole shoulder complex stable. So now we're just going to talk about some different things you can do to help your shoulders out. If you're not feeling any pain there today, that's awesome, and we want to keep it that way. And so we're going to go over a couple things to help out. So at Airrosti, we go over 3 general types of exercises to make sure that we're working the tissue correctly, but also making a change. So for these first 2, we have mobility and stretching. So mobility, you'd use, and that's not an exercise ball, it's a lacrosse ball. And what that's used to do is to work on the muscle almost in a sense of working out any knots. For those of you who've had the manual therapy that we do here at Airrosti, it's kind of an extension of our thumbs to work through the tissue. And then once you've done that and allowed the muscle to move a little bit easier, then we stretch it. And that just continues to improve that function. But you don't want to stop there. We want to do some sort of strengthening or stabilization exercise, because that's where you're actually activating the muscle and using it to do its job that it was assigned to do. Because what ends up happening is when we have some sort of a muscular imbalance, we have other muscles thinking they're helping us out when in fact they're making the situation worse. And so we just need to make sure that the right ones are staying in their lane and doing their job. And if everyone's doing their own job, what they should be doing, then we should have symptoms go down and healing occur. And so this is just a graphic of, and then of course, not all of us look like this, but this is an exaggeration. But what ends up happening is as our head comes forward, it increases weight around where that blue arrow is. And essentially our upper trap muscle, so the ones on top of our shoulder, and then our levator scap muscle, so the one that goes from our shoulder blade to our neck, that gets really, really tight. And then on the front of our chest, our pec minor muscle, that one also gets tight, reinforcing that position where it pulls our shoulders forward and brings our neck there. And again, just for exaggeration purposes, we end up looking kind of like this. What ends up happening then is our lower trap muscle, so at the bottom of the blue arrow, around there, it decides, I'm not going to show up to work today because everyone else is doing what I should be doing. And so then essentially, again, it reinforces that poor posture. Then the shoulder starts getting out of, for lack, this is a scientific term, it gets out of whack or just becomes wonky. And essentially, then we start developing these different overstress patterns that are causing the pain and some of this conditions that we already talked about. So a couple of things that we can do here. So in the picture, you can see the individuals on a foam roller. And with this one, when we have people come in office, we go through them and how they should be performed and what you should be feeling as you do them. And so for this one, it's starting in the mid back and it's just rolling through those muscles through the, like right between the shoulder blades and almost up to the neck. And the reason we focus on this again is because the whole shoulder girdle is directly related to how our mid back is moving and also into the neck as well. But we stay in the back as we roll back and forth through those muscles, again, to work them out, to increase that mobility. And I don't know if, if you've been to the gym and you've seen people foam rolling, a lot of times it's almost as if people are trying to rush through it and just say that they've done it. But when you do that, you're tightening up your muscles and you're not really getting the benefit from it. And so you really want to take your time, be intentional about it. And I mean, even if you only go through 1 or 2 passes and say like a 1 to 2 minute setting, that's going to be enough to really make a bigger difference than just simply getting on a foam roller because somebody told you to. So lacrosse ball. So this is that orange ball I showed you here. So with this one, this is a interesting one where you would place the lacrosse ball right at the little pocket underneath your shoulder. And then just as it's pictured here, you're going against the wall and just adding a little bit of your body weight and maybe a little bit extra pressure. One thing that we have to remind our patients is not to try to kill the ball because that's going to hurt more than help. But as you're working through the tissue there, you want to stay just in that little pocket there, because if you go down into where it's like the pec major and down into the chest tissue, that also ends up hurting more than helping. And so what this does is this allows for the shoulder to come back and just opening that up so it stops pulling down so much. And this is something you would do for about a minute. And of course, with all of these exercises, when it's focused on one side, even if the other side's not hurting, you want to do that just so, for lack of a better explanation, you don't want it to get jealous. And oftentimes too, the other side will be compensating for the injured side. And so you're going to have some extra tightness there. And so then that's also preventing some other injuries that could occur. So this is one of my favorite, but not the favorite, but very close. But with this one here, as you can see, it's right on the top of the shoulder there. I prefer to do this one in a bent position against the wall. So you're on a corner and it's just right on top here. And then you can just roll through the top of the shoulder. Same applies as with foam rolling or like with the pec minor. Again, you're just adding enough of the body weight to put some pressure on it, but also being able to stay relaxed while you do the motion. Of the rotator cuff muscles, we didn't talk about this earlier, the supraspinatus muscle, so the one right on top of the shoulder, that is probably the #1 out of all 4 of them that likes to speak up the most or get injured, if you will. So with this chest stretch, several different ways to do this. This is a very simple, I'd say probably the best picture-wise of what it looks like, again, because it's bringing the shoulder back and just opening up that chest. A couple other options, though, are if you go onto the corner of a wall and then put your hand at 90 degrees. And so this is the wall corner right here, and then this is touching the wall. Place it here, and then slowly with your feet, turn away from the wall. And then you should feel a stretch right on top of the shoulder and into the chest as well. And then if you're not quite feeling the stretch there, you can change that position to a Y position, and that will also increase it as well. And so again, you want to get to the point where you feel the sensation of a stretch. You're not looking to tear the muscle off. And so you don't need to push further than just getting that sensation of it opening up. And as you hold for at least minimum 30 seconds, that's where the tissue starts to release and allow for the stretching motion. This one also has several different variations. And so the idea behind this is so thoracic rotation, so mid-back, we don't use that a lot for rotating as much as we think or as much as we should. And so when that gets really tight and locked up, again, it affects the shoulders. So with this one, just as it's pictured, you're sitting down in a chair and then you're using it to just get that extra little bit of a stretch in there. Again, careful with this one, because if you're doing it too fast and also too forceful, you're going to find that you're going to upset some of the muscles in through the mid back there, and they'll let you know. So take it nice, easy, slow, and relax into the position. One of the ones that I'll teach in office that's very similar to this is you're standing up against the wall, shoulders touching the wall, and then you're keeping this still, and this arm is moving, and your head is watching this arm. So it goes out like this, and then for a second, I'll show you what the head does. And then you come back. And so as you look back there, you hold for about 2-3 seconds, and each time you try to get a little bit further. A common mistake with that exercise, though, is that this shoulder touching the wall tries to roll forward, and so then it's your hips that are turning. So you really want to keep everything stationary, only the outside arm and your head is moving to reach back behind you. And what you should be feeling is in the mid back and on the side, a little bit of a stretching sensation and increasing that mobility there. Arm circles, this is probably more fun than helpful. No, I'm just teasing, it's also helpful. But as you can tell from the individual picture, they're pretty happy about it. And so with this one, you can go forward or backward. You just have your hands at your side and you're doing circles here. And why this is helpful is, one, it's helping with stability of the shoulder, but it's actually also, it's almost like a two birds, one stone exercise, because it's also helping with range of motion because you're moving the shoulder and getting it activated as well. And so, but you want to do small circles. Bigger ones you can do, but that's just more for range of motion. But as you do these small controlled circles, that's getting all of the rotator cuff muscles involved, and it's also getting the rest of the shoulder girdle muscles involved as well, without adding a lot of weight or too much tension. And so then it helps and basically support healing. This one has a fun name, Bruger. Hopefully I said that right. So with this one here, this one's about working on posture, like more postural muscles. So it's involving the shoulders, the mid back, even a little bit of the neck. And so what you're doing here is you're taking a resisted band, and if you can tell in the picture, she's keeping her elbows right next to the side of her body. And so with that, she builds the tension, she holds the band at the side, which I could, maybe I'll bring this down so you can see a little better. And so then she's holding the band and then slowly pulling out, but maintaining that connection with her body. So one thing that we'll see in office sometimes is people will go like this, and that's not quite helping. We want to keep that nice controlled motion in through here. And then once you get out here, you hold. And the goal here is when you get to that end position is you're bringing your shoulder blades together, not so much that there's a pinch, but that you're starting to activate the muscles back through there. And if you recall earlier, that one muscle that decided not to show up to work, this is a way to get that muscle to say, hey, you should probably clock in because we need you to do your job. And it's really simple, really easy. We usually use our lowest resistance band on this one because we're not looking to necessarily build muscle. We're looking for it to just turn on and actually do it because it just needs to be working properly. All right, and so with Airrosti, basically we want to make sure that if you come for our care, that we are giving you the care that you need. And so we want to make sure that you're progressing. And so after each visit, what we do is we collect outcomes, and basically we want to make sure that, one, you're progressing and that the care is actually doing, what we need it to do. And so it's one of those things that if it's not progressing, if it's not responding to the care as we should expect, then we have developed great relationships with several Austin healthcare providers to make sure to get you in the right place. So it's, one of the great things that I love about this job is that I get to help you in here, or if I can't, I still get to help you get to where you need to be. With the Rossi, they're very meticulous about collecting all these outcomes, just so that we can actually throw these numbers at you. So we've already had over 1 million cases, patient cases, since Rossi started. It's funny, we always have this 3.2 average number of visits. I don't know what a 0.2 visit looks like, so usually I call it a 3 to 4 visits. For a case that's pretty straightforward, what I'll end up telling patients is, hey, let's schedule to the third because that's what I want to reach. But if we are making progress and things are going well, but we would still benefit from a fourth, then we'll schedule it at that point. But at the same time too, if we're done in 2, we're done in 2. It's one of those things where I love just that straightforward. We actually just get to take care of you. And so it's one of those things where around 90% people will report a full recovery from whatever the condition may be. And then with the other remaining people that didn't get better, for the most part, we're able to find the right place for them. And then this just has some other facts about, what patients had done either before or after care. And so a lot of times what will end up happening, another big question that pops up is, what about imaging? And that's one of the things is we help determine if that's necessary, because sometimes that's a cost that doesn't need to happen. but other times it is necessary because we need to know what's going on inside the body. And then just some common conditions that we treat overall. So we talked about shoulders today, but essentially if there's a muscle there, if there's a tendon there, any kind of soft tissue, that is our wheelhouse. That's what we have great results with. And we're able to tell essentially even after the first visit if we're headed on the right track. And so with that being said, when you describe what's going on with you, that gives us almost 85% of the information we need to know whether we're going to be helpful or not. And then after going through an exam, that also it basically brings that extra 15% needed to know, hey, is this going to be useful for you, or do we need to find something else that's going to really get you what you need? And then this is information on me. So I'm at the Far West location, probably the best office we have here. I have, the floor to wall or floor to ceiling windows, corner office. So that just kind of suggests how important I am. No, just teasing. But no, at my location here, we also have Dr. Pappas. And then there's several locations throughout the Austin region. Just like we described today, you'd have a much similar experience from office to office. I'm trying to think what else, Chris, do they need to know? Oh, side note, I do have Saturday morning hours, so that's a little bit different than compared to a lot of our providers. So that's a fun tidbit about me.